So we've got this little chihuahua under anesthesia. We just finished taking full mouth x-rays. He's definitely got some dental tartar, so he's going to get a good dental cleaning today. We've got all of our instruments here for setup for cleaning and extractions. We've got things like our scalers and our curettes just to help kind of clean and scale all of the dental tartar off the teeth, both subgingival and supragingival as well. We've got our mouth specs to keep the mouth open, some tooth forceps just to get off any of the big chunks of tartar on there. We've got our dental probe to see if there's any pockets. And then we've got our extractors, we've got malts and elevators and forceps, needle drivers, anything the doctor will need to use if she's going to extract any teeth. We've also got an air compressor machine that has our ultrasonic scaler. We've got a water and air source. We've got our polishing device here as well, so this will all come in handy when we're going to clean up those teeth. First thing we want to do is take a good look inside and outside of the mouth. So we're just going to fill those salivary glands, those submandibular lymph nodes, make sure there's no abnormal enlargement. We'll also go inside the mouth actually as well. Put on my gloves here. We're going to look at things like not only the gingiva and the actual tooth, but we're going to look at the tongue, the hard and soft palate, gums, just everything just to see if there's any masses, any growth, any swelling or redness, anything that's abnormal that could be kind of contributing to this dental disease. So just getting a really good look, and then that way we can make sure we kind of note it on the chart and let our doctor know if there's anything abnormal that we're seeing. Looks pretty good. He's definitely got some tartar there, probably some loose teeth in there that will get nice and cleaned up. Like I said, we already took full mouth x-rays to kind of see what's going on underneath the surface. We'll want to wear gloves and a mask. Just because all that tartar holds bacteria in the mouth, and once you start to scale that, you start to make all of that airborne, and that's the potential to go into your respiratory system, your mouth, your eyes. So we've got gloves, we've got our little face mask with our little eye shield on it as well. So what I'm going to do first is use the ultrasonic scaler to just kind of take off any of that surface tartar that I have, and if there's major chunks, I'll use our little tooth scaler here, or tooth forceps, to kind of crack that off first. We've definitely got some on this upper canine and his first premolar, and we'll just use that to kind of get it off. And as you can see, we have his head kind of angled down because we are going to be squirting water in here. We're going to be chunking off a lot of that debris in his mouth, so we don't want it to go back into the throat for a potential aspiration. So we keep that angled. We have this towel underneath the neck just to support the neck. And then once we start squirting water in there and kind of cleaning the teeth, we can use some gauze sponges as like a pharyngeal sponge just to catch any of the water that may happen to fall back in there. Since I'm not doing anything like that yet, I'm just going to keep those out. But good note to make on the chart, just so you make sure you get those sponges out before you excavate. So I've got our ultrasonic scaler here, and I'm just going to keep this parallel to the tooth. It works best that way. And I'm just going to work from the gingiva all the way to the crown of the tooth. Just nice and parallel. Because this is so high-powered, you only want to keep it on there for 10 to 15 seconds, and then work to the next tooth. So get off as much as you can, and then hop on over to the next tooth. That way you don't cause any damage to the tooth itself. So, and we're not only getting that front surface or that buccal surface of the tooth, but we're getting the palatal surface, the lingual surface, everything that we can to get off all that tartar that's built up on there. Courtney, do you want to come from behind me and see this? Get a little, I guess, more up close. So I'm just keeping the actual tip parallel to the tooth. working from the gum line all the way down. Just kind of keeping a mental note of how long I've kept it on the tooth. And then just working to the next one, getting off any of that tartar. And you're just kind of overlapping strokes here. If I couldn't get anything off in that 10 to 15 second window, I just go right back to the tooth and work at it until I feel like it's clean enough, or I can start using the hand instrument to get the rest off. Now I'll grab one of our little hand sealers here just to kind of get in the little grooves of the carnassial here. And then also just to go subgingival as well for any buildup that's right under that gingival line. And then I'm just going to start using the scaler again just to kind of get everything nice and clean on this teeth. This first premolar is pretty darn loose, so we'll note that on the chart as well. And we'll just make a note of any missing teeth or fractured teeth on there. Once we probe, we'll kind of note any pocket depths on there as well. We've got a little polishing instrument on our air compression machine, so we're just going to use that and some toothpaste to just polish these teeth. This is one of the low-powered instruments that we have, so we're just going to get on all surfaces as well. When we use that ultrasonic scaler, it kind of makes little micro ridges on the tooth. That kind of allows the tartar to build up pretty easily. So the polishing will kind of smooth out the tooth and allow that tartar to not build up as quickly as it would if you just skipped the polishing. It makes the teeth nice and clean and shiny. And again, just working this from tooth to tooth, making sure to just get every little surface. Water source here. Now I've got our probe here, and I'm just going to see if there's any pockets around these teeth. We've already taken x-rays to kind of see what's going on underneath the surface, but this will also just kind of give us a good idea of which teeth need to go. Now there's no pocket, but this first premolar is really, really loose and wiggly, so I'll have to just mention that and note that on the chart. But it doesn't look like any of them are going to have any major pockets. Missing a couple teeth back here. We have the chart. We'll just chart. So we've got the canine, the first premolar. We're missing that second premolar. So we'll just note that on there. We're missing the first molar as well. So we'll just note that on here. Otherwise, once we finish cleaning the rest of the teeth, we'll just make sure to get this guy nice and cleaned up and ready to go home. Okay. Alright, so we just got finished with our dental on our little Chihuahua, so we're just going to use our models to kind of give you a better idea of what we were doing in there. This is our canine model. As you can see, got all of our teeth in here. All of our incisors sit right here at the front of the dog's mouth. We've got 6 on the top, or on the maxilla, and 6 in the mandible as well. And then we've got 2 canines on both sides of the incisors, both on the top and bottom of the jaw as well. Bottom of the canine mouth, we've got 4 premolars, and then we've got the 3 molars on both sides. And then on the top of the mouth, we've got the 4 premolars and the 2 molars as well. Major things with dogs is they can get a huge amount of calculus, tartar buildup, so that can really play into periodontal disease that these guys get. You start to get buildup of this calculus, you start getting inflammation of the gingiva, which can cause pocketing, and that tooth root really starting to become more seen, which is not what's supposed to happen. That calculus can really break down and kind of vary its way through, which just causes a lot of pain and discomfort for the patient. You can get things like oral nasal fistulas, which is kind of like an abnormal hole between the oral cavity and the nasal cavity, which causes, again, a lot of pain and just an abnormal hole that's not supposed to be there. And the bone between those cavities start to break down, that little hole starts to form. And it's usually right around the canines on the maxilla of the patient. You can get things like tooth root abscesses, which is just an abscess that forms at the root of the tooth. Usually we see that on the carnassial, that 3-rooted premolar on the upper maxilla of the dogs. And it can cause some pretty heavy facial swelling, a lot of pain and discomfort. That can be caused by periodontal disease, things like foxtails or foreign bodies that get in there that just cause this inflammation and swelling and just kind of causes pus and an abscess to form at that tooth root. The different surfaces, and what's really important when we're doing dental prophylaxis is to make sure that we're cleaning every single surface that we can. That way we can control and kind of break down that calculus and tartar that's on these teeth. So we've got the buccal surface, which faces towards the actual cheek. We've got the palatal surfaces, which are on the upper inner surface on our canine patients and feline patients. And then we've got the lingual surface, which is the inner surface towards the gum, or towards the tongue, on the maxilla or mandible. So it's just really important that when we're cleaning, we're getting every single surface. We're really cleaning every little crevice, because anytime we can get that tartar off, we give our patient a kind of cleaner, fresher mouth. It causes a lot less disease in these guys. Same with the cats. You've got same surfaces, a different amount of teeth. Dogs have 42 teeth, whereas cats have 30 teeth. But again, the same kind of concept. You've got your incisors, both on the maxilla and mandible. You've got 2 canines on either side of the incisors, both on the maxilla and mandible. But cats have far fewer premolars and molars. So on the cats, you've got the 3 upper premolars, and you've got 2 premolars on the bottom, and then your molars right behind as well. So again, same concept with cats. I've seen, just in my experience, cats having a lot of dental disease and having a lot of dental issues like tooth resorption, and a lot of cats that have come through here have ended up having to have their whole mouth extracted just because of heavy periodontal disease and these tooth roots that are just kind of retained in there, and the crowns are broken off. So really important to make sure that when we're sending our patients home, we're telling them about how important home care can be, whether it's making it really diligent about cleaning the teeth, and you can get toothbrushes and toothpaste and actually brush your dog or cat's teeth. They're not always very tolerant of that, but it can really be helpful in cases where some of these cats get their full mouth extracted because their teeth have just kind of been plagued with disease. You can also find like water additives that kind of prevent or create a film on the tooth where calculus and tartar won't build up as quickly. Now really popular, they've got dental chews that kind of help to break off any of the tartar that's there and just kind of keep the mouth cleaner. Are they always, 100% workable? Not necessarily. The best thing is brushing our teeth. And I think human dentists would say the same thing. If we went months, weeks, years without cleaning our teeth would end up looking like some of our canine and feline patients with just a huge tartar buildup. So it's really, really important that owners at least attempt to kind of keep everything nice and clean at home. But like I said, canine and feline patients aren't always going to be tolerant of that. But the best we can do is try to use some of these aids to kind of help along the way. Once the patients are here, we like to use different scalers, curettes, polishers to kind of help us clean their teeth. And in the dental, you saw me using an ultrasonic scaler, which is a air compression scaler that really is a powerful tool to use that kind of just scrapes off any tartar that's on the tooth. Because it's so high powered, it can actually cause damage to the tooth. So we only use it for so long on each tooth and then kind of work to the next tooth. And it's not necessarily as safe to use subgingival, so under that gum line. So we'll use things like curettes. And if you want to focus in on this skill, we've got things like curettes that have a rounded edge to kind of get under the tooth surface, and we can kind of scrape off anything that's built up under the gum line. And then we've got things like scalers that are kind of more fine-tipped, sharp-tipped, that we can also use on the crown surface and subgingivally as well. And that just helps us ensure that everything is kind of being cleaned both on the crown surface and under that gum line. So we just use our little curette to keep it nice and parallel to the tooth and just getting under that gum line, just kind of creating a back and forth motion to really just scrape off any tartar. And we would do that on all surfaces, so you're just kind of using the curette and just really getting under that gum line. And you can also use this on the tooth surface as well, just to scrape off anything on there. It's nice to have these ultrasonic scalers because they are very powerful, but to keep it safe and keep all of the areas of the tooth healthy, we use these hand instruments to kind of keep everything clean. And same goes for the cats as well. Same technique, just keeping that scaler and curette nice and parallel to the tooth and really just doing these back and forth, almost crisscross motions to just get as much of that tartar off. And then we can go in with our polishers to kind of get rid of that micro little ridges that we've created, just scraping off all of that tartar. Right here on this sheet, I have the dental formulas for both the cat and the dog, and this just is a way to calculate or a way to show how many teeth the dog and the cat have. So they've got 3 incisors on each side of the mouth, both upper and lower, so that's a total of 6. You've got 1 canine on each side, so 2 canines on the upper, 2 canines on the lower. They've got 3 premolars on the upper, 2 on the bottom, and then 1 molar on both the maxilla and mandible. So cats have a total of 30 teeth. Dogs have 3 incisors on both the upper and lower side, so that's a total of 6 upper, 6 lower, 1 canine on each side, and then 4 premolars on both upper and lower, and then 2 molars on the up and 3 on the mandible. So total of 42 teeth, and that comes in handy when we're charting to make sure that we chart anything that's missing, and then afterwards, if we have extracted any teeth, to chart anything that we've extracted. We also use dental charts to kind of note pocket depth, if we've got retained roots, if we've got an oral nasal fistula, if we've got a tooth root abscess. That can all help kind of explain to the owner what's going on inside their pet's mouth, and we'll kind of give them a better idea of what they need to take care of at home. So dental disease is a huge thing we see in canine and feline patients. It's kind of one of the top things we do here at dentals, because we've got some dogs and cats that don't have the best of teeth, so it just goes to show how much home care can really help before we rack up these big bills and have to do these major procedures on some of our patients.